Luana Locke was 25 years old and very pregnant. 8 months pregnant with her first child, Lucas, when she discovered a tiny lesion on her breast. She thought, this is going to interfere with my breastfeeding. So she went to the doctor.
I always say that, Lucas saved my life because honestly, if it wasn't for him, I really would probably not have paid attention to that small little lesion until it had grown and then become something that maybe was not manageable because it was caught at a very, very early stage.
It was breast cancer, and luckily caught very early, surgically removed, no chemo or radiation required. But it didn't end there. Since then, Luana has had breast cancer a second time, then lung, thyroid, sarcoma, and skin cancers. You've been diagnosed with cancer 6 times.
To varying degrees, yes.
That is overwhelming. Luana, as it turns out, has a genetic mutation that virtually guarantees her getting cancer. Now, I can't imagine living life knowing cancer will be part of it, but her answer to my next question might surprise you. The level of PTSD that you must live with on a regular basis, do you recognize that?
I mean, there's definitely anxiety, and there are times where I have to talk myself off the ledge, I guess, so to speak. But no.
No. Luana has had cancer 6 times, and it's entirely possible she'll get it again. She says she doesn't worry about it, at least not too much. But how can that be? This is Carry the Fire, a podcast by the Princess Margaret Cancer Foundation featuring inspiring personal stories about what happens when world-leading doctors, researchers, nurses, and their patients come together to ignite breakthroughs in cancer treatments. Asked about innovation and radical hope. I'm your host, Lisa Laflamme. On this episode, how to catch cancer early. Early detection. I feel like I'm sitting across from Superwoman.
Oh my gosh. You know what? That's so funny that you say that, Lisa, because my daughter once said to me, she was asked what she thought my superpower was. And she said, beating cancer.
So many other members of Luana's family haven't been as lucky. She's lost her mother, her brother, her sister, aunt, nephew, and 2 cousins to cancer. 7 people in her own family. It's something I asked Luana's daughter, Juliette, about. She and her brother, Lucas, have come along with their mother to meet with me. It must be hard at Christmas time when you look around and there's so many of the extended family that isn't there because they didn't have that opportunity.
Yes, this is true. It's funny because you look around at other Italian families and they're always like, yeah, like the big Italian family. And then I'm like, oh, why do we have so little family members? And then I'm like, oh, there's a reason for that.
You'll also hear from Juliette's brother in a bit, but first, back to Luana. When she was initially diagnosed with breast cancer, she was sent for genetic testing. Nothing showed up. Then, a few years later, her cousin in Italy was sent for genetic testing.
And she was the first one in my family to have a confirmed Li-Fraumeni syndrome because it was during that period of time, I guess the 1996 and early 2000, where Li-Fraumeni syndrome had been further defined.
Li-Fraumeni syndrome, also known as LFS. There's a 100% chance that people with LFS will develop cancer in their lifetime. And there's a 50-50 chance you'll pass it on to your kids. So the question now became, what about 4-year-old Lucas? You're such a strong woman and you've gone through so much. What's it like, though, when it's your child?
The first time he was tested that weekend, he slept with me in bed and I hugged him all night long, all weekend long. And I think I've never probably hugged him as tight as I did. He probably misses those hugs.
All the hugging in the world couldn't shield Lucas from the outcome. If your friend says to you, hey, Lucas, what is this? Liefraumeni thing. How do you describe it to them?
How I would describe it, I guess, is we all have something in our bodies that regulates cell reproduction. And in the case of myself and my mom, my sister, and other family members, of course, our bodies don't regulate our cells the way that they should in some instances.
More specifically, LFS is a defect in the TP53 gene, which is a tumor suppressing gene. So, what do you do if you have that defect?
So since we found out that I was confirmed to have Li-Fraumeni syndrome, at that point, I began to follow a protocol, which is known as the Toronto Protocol. And that is the screening protocol for people with Li-Fraumeni syndrome and probably applied as well to other hereditary cancer syndromes. But it basically includes yearly MRIs, full body MRI, brain MRI, blood work, ultrasounds, things of that nature.
When Juliet was born, she also tested positive for Li-Fraumeni syndrome. She goes for screenings every 3 months, blood work, pelvic and abdominal ultrasounds, and urine analysis, as well as annual full body and brain MRIs. For Lucas and Luana, it's also annual whole body and brain MRIs, a colonoscopy every 2 years, annual pelvic and abdominal ultrasounds, but the skin tests and blood work are still every 3 to 4 months. Julia, here you are as a little girl doing something that your school friends probably were definitely not doing. What's your earliest memory of the screening process?
When I was younger, I was really scared of needles. And so my brother, who is very used to it at this point, would be like, Julia, and I would look over at him and he would stick his arm out and he would, motion stabbing a needle into his arm. He would go like, pts, and repetitively, and it was so scary. And that is like my PTSD of pre-screening.
Lucas, do you want to officially apologize right now for the trauma you put your baby sister through?
I really would like to, especially because her expressing to me, it was so scary. I always just thought it was, I know that she didn't like it, but I didn't really realize how,
the impact
right.
you were having.
It was bad. Like screaming, like, Mom, like it was bad.
Sorry about that.
At least screenings were a family affair. You might wonder how Luana's story relates to you. The odds of having LFS are about 1 in 30,000, so you most likely don't carry the same genetic mutation. But here's the thing. Nearly 2 in 5 Canadians are expected to develop cancer during their lifetime. While the healthcare system doesn't allow for all of us to receive annual or even biannual MRIs, new diagnostics are being tested at this very moment. Hello.
Hi there, this is Nafisa calling from the Pathfinder 2 team. What I'm going to do is just going to go through a couple of questions with you regarding your eligibility for our study.
In fact, I've been enrolled in the Pathfinder 2 trial for something called a liquid biopsy, a potentially groundbreaking approach to finding cancer. So explain what a liquid biopsy is.
So when you look at a blood tube, if you spin it at a high velocity, the different areas start to separate like a B-52 drink.
Dr. Raymond Kim is not a bartender. He's the medical director of cancer early detection at Princess Margaret Cancer Center. He works with Luana and her family.
You have the bottom part that is primarily the red cells, and in the middle part you have this white area, and those contain the white blood cells. And those fight infection, and that's actually the tissue that we use to do genetic testing of your inherited genetic material. The top level is clear. It's called plasma. And plasma contains blood products. It contains clotting factors. It contains protein. And recently, it contains thing that's known as cell-free DNA.
Cell-free DNA is fetal DNA that circulates freely in the maternal blood. About 10 to 15 years ago, researchers found they could take cell-free DNA from the placenta to screen a baby for their non-inherited genetic mutations.
And it was with such high accuracy that the genetic composition of the baby was being analyzed that some of the other tests we didn't need anymore.
I may never drink a B52 the same way again, but that is a fascinating explanation. And so, who qualifies now? It's not just for pregnant women anymore.
Yeah, so this is where the test needs to be refined for a variety of different indications. So you can imagine the placenta in a pregnant woman is a large organelle or organ, and it secretes tons of cell-free DNA. So the analysis is quite straightforward. But somebody who has a small little cancer, that's going to be much more difficult to detect. And the assays that are being used are being modified and honed to detect cancer in different types of situations.
Depending on the test, a liquid biopsy can identify up to 50 cancers. But where in the body do those cancers exist? Locating the source of the early forming cancer has to do with the wrapping of the DNA, something called epigenetics.
And the epigenetics piece is actually very important in figuring out where in the body a cancer is coming from. So we can say, okay, this person has perhaps a colon cancer, this one has a brain cancer, this one has a breast cancer. So we can look in the body more precisely for follow-up investigations.
In a perfect world, is this liquid biopsy something that could eventually be part of your annual physical?
Yeah, so that is the ultimate goal, is to create a adjunct or a supplementary cancer screening test you can take to your physician, and you would get that blood test maybe once a year, maybe once every other year, depending on which. And then your cancer signal seems okay, so we should, carry along. And if not, then perhaps we need some more intensive investigations in your body that you otherwise wouldn't be looking at.
Dr. Kim says that among trial participants, 1% are expected to have some form of cancer. Now, 1% is a low number, unless, of course, you're in that group. And I can't help but feel a small level of anxiety. What if they find something in me?
Honestly, for the most part, I think I take it all in stride. I mean, I honestly have made an art of coming down to the hospital, having whatever diagnostic tests are being performed that quarter or that year, and leaving the hospital and then making a day of it. We're going for lunch, we're doing something, we're just going straight home to do homework or whatever it is. But the point is that I don't think about it at all. If we don't get a call, there's never another thought.
I'm not sure I can be that zen about the liquid biopsy, but remember, for Luana, it's become almost routine. She's accustomed to it. To try to explain the Locke family's extraordinary level of calm in the face of almost certain cancer, I think we have to go back to Luana's cancers. Remember, she's had it 6 times.
So, I mean, I would say, so the breast cancer, the lung cancer, the thyroid cancer, those are ones that, typically we associate with feelings of, symptoms, having symptoms. The only time I ever had a symptom were actually the lesions, was the sarcoma, because I saw that there was a tiny, tiny little growth on my shoulder that wasn't going away. And the skin cancer, because I saw that it was an abnormal looking patch on my skin that was changing in appearance. But the more serious ones, I'll call them, the breast cancer, like I said, thyroid cancer and lung cancer, I absolutely felt perfectly well going in. I had 0 symptoms.
0 symptoms, caught so early that the cancers required surgery only. And each of these 6 cases was found through early detection, something the liquid biopsy is trying to accomplish.
Exactly, through screening. That's right.
Have you ever required chemo?
No.
So early detection probably is best defined by catching cancer earlier than conventional methods. For instance, most cancers, we don't have a good screening tool.
This is Dr. Raymond Kim again. We've all heard about mammograms, cervical pap smears, and colon stool testing. Those tests screen for symptoms.
But aside from those 3 cancers, there's not many early detection tests for other types of cancers. There's We're looking into the utility of CT scans for lung cancer, but chest X-rays we know don't really catch lung cancer very early. Brain MRIs for brain cancer don't really work, and pancreas cancer, ovarian cancer, and a lot of different types of cancers don't have good tests for us to catch those cancers early.
And explain then the impact of early detection in the overall picture of a cancer patient. What changes when you find it fast?
So overall survival and cure changes when you detect cancer at the early stages. There is a concept known as stage 0 cancer, where it is so early that the traditional staging of 1, 2, 3, 4 doesn't quite match what it is. And we know those patients, even stage 1 patients and stage 2 patients, they are cured of their cancer and do not need a lot of the harsh chemotherapies and the harsh surgeries and all of the other things that horrify us about some of these cancer journeys.
No surprise, early detection saves lives. If the liquid biopsy finds cancer in me, the theory is that it'll be much easier to treat. But Luana has some advice to those leaning solely on tests and screening. Vigilance.
You have to have both those things in concert. You can't just, blindly say, oh, that's fine. Every 3 months I'll go for my ultrasounds and whatever screening I have, and then not do your part. There are definitely things that you need to do as well. So you have to look for differences in your skin or any lumps and bumps. When my brother was diagnosed, his first diagnosis was a sarcoma in the thigh that had started out the size of an almond, is what he described it to me. And by the time it was removed, it was the size of an orange. And that happened really, really quickly.
Luana's brother didn't survive. She is one of the lucky ones.
There's never another thought. At least there wasn't for many, many years. Let me put it that way.
But one day after a screening, Luana did get a call.
Yeah, that was not a good day. So we went down. It was during COVID. It was a Friday, April 16th, 2021.
Yeah, I'm sure that's a date you ingrained in your brain forever. It wasn't for her, though. It was for Juliette. At 14 years old, her daughter had cancer.
She had been complaining of shoulder pain. That was really the only symptom that she had prior to diagnosis.
Acute lymphoblastic leukemia. This time, the cancer wasn't so easily dealt with. There was chemo and radiation. How did you prepare yourself, or did you, for the possibility that one day one of those tests would result in a cancer?
I've never been scared of it because it was just like, okay, we go, and then if something happens, something happens.
And when it did happen, were you scared?
I wasn't scared. I was emotional. And I even asked my mom that day, I was like, is it ever not sad? And she was like, no, I cry every time, even if it's expected. But I wasn't scared. It didn't get scary until later when we found out that I didn't go into remission from the induction phase.
Juliette went through 28 days of chemo, but the cancer wasn't responding to the treatments. When you're looking at your little girl and knowing this is a genetic disease, she has it, and this is the first time she's undergoing treatment for cancer.
It was just awful. The nausea, the pain, the weight loss, the hair loss, all of it really traumatic to see a 14-year-old girl that up until a week before seemed to be doing well and thriving and didn't really have too many symptoms. And so that was a hit.
And would require more chemo, or what do you do at that point?
So that was a big question mark. And typically, yes, they might have looked at actually not necessarily, maybe more chemo. They might have looked at a bone marrow transplant. They might have looked at a number of different options. But again, factoring in Juliette's Li-Fraumeni syndrome, they did something that was a pretty new approach for people in Juliette's circumstances.
Luckily, and with good timing, Juliet qualified for CAR T-cell immunotherapy. It worked, and with screenings every few months, she's been cancer-free for a few years now. Which brings me back to the difference between Luana and her family, the 5 to 10% of people who have hereditary cancer like Lee Fraumeni, and those who don't. So we can learn something from hereditary cancer for the average person, if I can put it that way, who is diagnosed with cancer. What do you learn?
You learn so much from these needles in the haystacks, these Rosetta Stones like Luana's family, on how the biology of cancer actually happens. So unlike the normal people, they get a brain MRI every year, whole body MRI every year, a breast MRI every year. And then we can see how they progress through life in their different types of cancer encounters. And through that, we can do research on them. And that's the research Luana and I participate in learning early cancer detection tools in these families, so we can eventually use that in the general population.
Wow, that is an incredible gift, the way you've just described it. What Luana and her family and so many others are actually doing to change the face of cancer for those without hereditary cancer. I had no idea there was such a link. Dr. Kim considers the research he does with the Locke family to be, to a certain extent, a partnership. Sometimes to Luana and her kids, though, it can feel like a whole lot more. So it's clearly also for him not a job.
It's not a job.
Passion, it's a vocation, and you are, must feel like family after all of these.
Yes, Dr. Kim has committed something to me. He has committed to being the person who checks me into the senior citizen home, which for a Lee Fraumeni syndrome patient
That's pretty special.
is really special.
I always enjoy speaking with Dr. Kim. Today we had a good laugh about my beard. He always insists that I shave my beard. And today we had a good laugh about that because I said to him, Dr. Kim, I follow your lead. And he said, well, clearly you don't because you still have your beard after all these years.
Luana might feel like Dr. Kim is a member of her family, but he has his own family to take care of also. But in your own personal family, your actual family, have you been touched by cancer?
Yes, very much so. My mother has 2 cancers. I come from very humble roots. My mother was a housekeeper at North York General Hospital, doesn't really know what is going on. So she just defers to me and then just goes through all of her appointments.
Man, she must be so proud of her boy. That is really beautiful.
Yeah, and I think being touched by cancer and having my own personal experience has really also augmented how I treat my patients, because I see how my mother is treated because my colleagues treat her like they are her family. And the same should be done, like for especially the unique people that I take care of, because they're a little bit different. But speaking of early detection, like she has kidney cancer and bladder cancer. So her kidney cancer was diagnosed incidentally meaning that she just had her scan for another reason. And then through her kidney cancer treatment, her bladder cancer was detected early. So I'm pretty sure early detection worked for her, but she was one of the lucky ones. And there's a lot of lucky stories out there, but there's a lot of unlucky stories out there. So we need to kind of push ourselves to try to address everybody so they can be those lucky stories.
I can say for myself personally, when I signed up for the clinical trial for the liquid biopsy, there was a small level of anxiety. What if they find something? But then in speaking with people like Luana, you realize that is actually a comfort level to know something so far in advance that you will not be walking in and finding out your stage 4. You can deal with it that early on. What do you think people should know about early detection that is not widely acknowledged right now?
I think knowledge is power. not knowing the information, unfortunately, is not going to change the natural history of what you are about to face. The utility of early cancer detection is, yes, nobody wants to have cancer, but knowing you have cancer at an early stage and having a very good chance for cure is probably better than not knowing and waiting and being kind of, ignorance is bliss type of approach, and then showing up in extremis with cancer that could be potentially fatal.
Awareness and knowledge, something people like Luana, Lucas, and Juliet have thanks to all that early detection and all of those screenings. They're going about their lives doing what a lot of other people do, like taking a trip to Italy. Oh, wow, that's a beautiful trip.
Very exciting. Lucas will not be there, but I'm very excited.
Yeah.
But I've been, yeah.
What do you think about when you look at the future? What are you prepared for, Juliet?
Prepared for anything and everything. Like, truthfully, like, I'm being so honest. I'm not putting on like a face, trying to be like, yeah, like, I don't think of it. No, like, in my future, I never think of like, oh yeah, like, when I get cancer eventually. The one thing I do think of is like, oh, when I get married, like, I wonder if if that's gonna like scare someone off. They're like, oh, you're gonna get cancer. Like, that's the only thing that I'm kind of like, I wonder how like a future potential boyfriend would think of that. But other than that, it's not like I'm worried about it.
Do you think about being a mother one day and then your child will ultimately go back through the same screening process that you've done since birth?
Yes. Fortunately, now there are options to avoid that. So I think you could do IVF, and then they can test the embryo before it's implanted and then check to see if they too carry the LFS gene.
So the future for me, I think that, yeah, we share a similar optimism, right? We're going to go on living normal lives the way that we always have and the way that we always will, right? LFS is just, we've said it time and time again, it's there, it's a part of it, and that's it, right? There's no real other way to look at it or to approach it. We take everything as it comes, right? And yeah, we're very optimistic. I'd like to have kids one day for sure, and kind of just go through the normal course of living a life, right? House, wife, career aspirations, that's it.
Is there anything else you want to add to the power of early detection? It is something that is still in nascent form in this country, I believe. Most people are not going through early screening for cancer, but it may be something down the road.
And not only for people who have predisposition syndromes, right? I mean, think about, I don't know what those numbers are, but obviously they're staggering, what it costs to treat a cancer patient, whether it's surgically or whether it is with rounds and rounds of chemotherapy and radiation treatment. Those things are really costly and clog the system. Imagine early detection. Imagine going for these tests, even the liquid biopsy that you're about to undergo yourself. Good luck with those results, by the way.
I'll be calling you first.
Yes, please. But the power that gives you, and then so you have a diagnosis. I mean, with liquid biopsy, even prior to the cancer actually being visible in your system, there are cells that are shed, right? And so then they know where to look and what to follow and how closely to follow you for what. So what type of cost savings are there? Not only the savings of lives, right? And obviously what people have to go through when they go through traumatic type of treatment that's really, really hard on the body, and the hair loss and the way you feel physically and all of those things, but on the medical system as well.
You've been listening to Carry the Fire from the Princess Margaret, a world-leading cancer research center. If you found this episode meaningful, please subscribe, rate, and leave a review. To learn more, check the show notes and share this podcast with friends and family to help spread the hope for a brighter future. I'm Lisa Laflamme. Thank you for listening.